Joining me now is Dr. Sarah Patterson of the University of Michigan. Dr. Patterson, it's great to see you. Thanks for joining us this morning.
Yeah, thanks for having me on. I appreciate it.
And I do want to congratulate the University of Michigan on winning the national championship.
Right.
I did not watch the game because it's past my bedtime, but I'm
Yeah.
sure you guys must be excited. So
Yeah.
congratulations.
Thank you. It's been really fun. I also, admittedly, I don't know if I can, but I also went to bed early.
Yeah, well, you have an important, we're going to talk about the research that you all do there. I mean, this is very, and a good segue. So, congratulations to all the folks watching this at University of Michigan. Well done. We'll see you again next year. Well, Dr. Patterson, obviously you do a tremendous amount of research in this area. I guess I know just from anecdotally from talking to other guests that caregivers are under a tremendous amount of stress, and oftentimes they're unpaid or they're paid a small amount of money relative to the work they're doing. But you've done a lot of research in this area. So let me ask you a baseline question.
Yeah.
Who pays for caregiving?
Yeah, so family caregivers and friends and community members are providing a lot of care for older adults in our communities. We find that about 88% of care provided to an older adult is done by their family members. And so they're doing the bulk of it. But, I've done focus groups with caregivers in the community, and I find that friends are pitching in, people from church are going to get groceries once in a while for someone. So it's really a family and community-based event. And what they find is that about, $7,000 out of pocket per year is spent on older adults care by family members or friends or other people. So older adults, even, if they're not getting a paid helper, so they're not paying someone to come in or they're not in a facility that requires payment, family members are often paying for medication, paying for somebody to come by, and doing these things that cost money for them, that they're paying out of their pocket because there's not a lot of support programs.
Well, $7,000 to me seems like a lot of money. I would imagine thinking about the average American income, that's a big proportion of someone's income. And let's not even account for, I'm not an economist, you're the professor and doctor, but there's opportunity lost when you're taking care of a loved one and you're probably not getting compensated. So that's a big out-of-pocket expense.
Yeah, I think it's a huge cost for people. And if an older adult needs more intensive care, so if they need to go to a nursing home, that can create even bigger costs. So locally here in Ann Arbor, Michigan, the cost to put an older adult in a nursing home that specializes in memory care starts at $12,000 a month. And as you can imagine, that is a huge cost for many families, and often they're going it alone.
So how do they, I mean, do you take and maybe you didn't look at this in the study, but
Yeah.
do they take a reverse mortgage? I mean, how do you pay for something like that? Because $12,000 times 12 is $144,000. I didn't learn my multiplication tables, but
Right.
that seems like a lot of money, and it's starting at that.
Yeah.
How do they pay for that? I mean, does Medicaid, Medicare, long-term care insurance cover some of that?
Yeah, so it depends on what people have. If they have long-term care insurance, that can help pay for it. If people are on Medicaid, that can also pay for it. But I know that you've had other speakers on where they've talked about the fact that you have to spend down and you only have a certain amount of assets that you're allowed to have, which then creates other financial problems for families. But oftentimes families, there's not a lot of planning that goes into this, often because people think it might not happen to them or they're just not sure. There's a ton of information out there. There's a ton of things that can happen. And so I think it's often hard to plan. And even people who make plans, things might come up. But really, a lot of people, I think they either don't pay for those facilities or they, scrape by somehow by taking out loans and things like that. So that's what I would say. Yeah.
Yeah, and I don't want to use the C word crisis because
Right.
that's often overused, but it seemed to me in an aging society of which, we're all, we're going to have more people that are age 65 at any time. I think they call it peak 65.
Right.
We've got boomers. I'm Gen X.
Right.
The millennials, right? There's going to be a lot of people that are going to be needing care. Are we at a tipping point where we need to come up with a national or at least state level solution to
Mhm.
some of these major challenges with look, getting old is great. You want to live long, but this is part of the challenge.
Right. Yeah. So I think just based on the number of older adults that we have turning 65 each day, which is estimated to be about 10,000 people a day, there are more needs among older adults in the community for families to take care of them. And so what this means is that we are reaching, again, like you said, crisis, gets thrown around a lot, but for many families, it can be a crisis. So having to take on this care can impact their ability to work, which then impacts their own ability to save and have safety nets for themselves later down the line. It can impact their health, their emotional well-being. So it can have a huge impact on the family caregivers that are providing this. And I think what you see is that it's sort of a groundswell sort of situation where now this is becoming much more common. So before, parents didn't live that long, people are living much longer, so we're enjoying these experiences with our parents much longer. But basically we're living longer with our parents, and that's allowing people to extend their life course with their family members, but then that means more years together where they're needing care later in life, which is then putting that impact back on the caregivers.
What about, we have migration in this country where people move from, I grew up in Baltimore, Maryland.
Right,
I live in Charlotte. My parents still live in Baltimore. Now
right,
that's only a 45-minute or an hour or so flight, but there's a distance now. We don't have our families living. I mean, maybe in some communities that still occurs, but
right.
it used to be that the grandparents live with their children or one of their children, right?
Yeah.
So that creates, I think, another layer here.
Yeah, so in the US, we're a nation of independence. People want to live in their own home by themselves or with their partner long into later life. And so what that means is that families move away, like you said, which causes a distance between being able to just, go across the street to take care of your parent one day if they need something. But what we find is that even if children or other family members live far away, they're still providing care for older adults in many ways. They're helping to manage their health care either through participating virtually or making calls. They're balancing their finances and tracking that. They might be hiring somebody to come in and help take care of the older adult. So even if people are geographically dispersed, they're often still caregiving from far away. But it does raise the question of, who can help with what? Because, for instance, you can't help someone eat or bathe if you live a few states away. So it does create an issue for some families where there is, a particular person who does that, and then someone else does different tasks. But it does create an issue for older adults and caregivers.
Well, certainly, if you look at your research, I think there's research by other academicians. I think AARP just put out something not too distant in the not too distant past about the cost of caregiving, somewhere, quantifying opportunity lost. So, are there answers? I mean, you said there's a groundswell of, maybe paraphrasing you, but a
Yeah,
groundswell of need or
yeah.
information. Is this where kind of the private sector and government, both state, local, federal, and you know, try to work together to come up with solutions? Because it seemed to me that, you know, you need to, if you're a, Gen Alpha, you need to start saving now for these challenges down the road.
Yeah, yeah, it's for sure. And what we find in our research on people's attitudes towards who should be primarily responsible for paying for older adults' care, we found that over a time, more and more people are saying the government should primarily help pay for caregiving for older adults. And I think the tricky thing about that is that they're not saying the government should do all of it. People still really want their family to caregive for them. Families want to caregive for older adults. But really, I think it's more that the public is saying we need a little help and we need a partnership between the government and families and these sort of social safety net programs and families in order to take care of all the older adults that are going to need care into the future. And that can look a lot of different ways. So, for instance, it could be tax credits. I think tax credits are increasingly gaining popularity. In polling of people, of Americans, you find that they're highly supported. Both caregivers and the general public highly supports tax credits for caregivers. But there's other options, right? We could technically pay family caregivers out of different programs, but really tax credits have shown themselves to be widely popular, as well as a few states have implemented them with great success.
Yeah, I kind of like I think you're right, absolutely. I think this is going to be continue to bubble up as we continue to get older. This is going to be a strain, and especially when there's affordability challenges going on now with
Mhm.
price of gas, food, etc. Maybe some of those prices will come down, but at the end of the day, if more people are getting older and we have fewer caregivers, the cost of caregiving could really skyrocket. Dr. Patterson, we're going to have to leave it there. Great research, but look, we look forward to having you back on the program again very soon.
Great, thanks. I look forward to joining again.
Well, thanks for watching, and don't forget, we're back again tomorrow morning with another great expert and another great topic. You can tune in right here Monday through Sunday at 7:30 a.m. Eastern Time. And don't forget to subscribe to our daily newsletter, The Morning Pulse, for all the news in one place, delivered directly to your email box. Check it out at our website.